I'm Pamela Wu, and with me today virtually are Dr. Candace Sauder and Dr. Diana Miglioretti, two of our physicians and researchers at the UC Davis Comprehensive Cancer Center. As many of you may know, October is Breast Cancer Awareness Month. It's an annual campaign to increase awareness of a disease that affects 1 in 8 women. We'll be discussing breast cancer, its treatment, and the research that's being done at the UC Davis Comprehensive Cancer Center. If you have questions today, please feel free to post them in the comments and we will answer them toward the end of the discussion. Doctors Sauder and Miglioretti, thank you so much for being with us.
Thanks for having us.
Now, according to the American Cancer Society, as I just said, 1 in 8 women will be diagnosed with breast cancer in their lifetime. And it really seems like almost everyone knows someone that's been affected by breast cancer. Let's first start with the risk factors and who can get breast cancer. Dr. Sauder?
I would say that all women can have the ability to get breast cancer. Some are more likely than others due to things such as family history or genetic sort of predispositions. I know that Dr. Miglioretti has done quite a bit of research sort of looking at some risk factors and some things, and so she may want to share some of those with you as well.
Sure, yeah. So our strongest risk factor for breast cancer is age. And so as women get older, the risk of getting breast cancer greatly increases. And it starts to become worrisome enough to start screening around age 50. However, there are other risk factors that have been identified that can increase your risk. Importantly, are some of the high risk, very strong risk factors like genetic mutations, which are rare, but BRCA1 and 2, or having chest radiation to treat childhood cancer. But there's some more common risk factors that we need to worry about, such as a general family history. Women with a family history might want to consider starting screening younger than 50, maybe at age 45 or 40, depending on how strong the family history is. Being overweight or obese is a very strong risk factor for postmenopausal women. So we encourage women to try to maintain a normal weight, and women who are overweight might want to start screening earlier or be screened a little more frequently. Some other risk factors include when you've had your first child, if you've never had a child, you're at increased risk of breast cancer, or if you've had a child after age 30, that slightly increases your risk. And then something we'll talk about probably more later is breast density. Women who have dense breast tissue are at increased risk of breast cancer. So these women with risk factors might want to talk to their doctors about starting screening at a younger age, maybe at age 45 or age 40.
A lot of patients probably ask you, what are the symptoms of breast cancer?
I wish I could say that there was a specific symptom that people could look for. Breast cancer is actually often painless. You can see some changes in the skin, even though that's rare. You can feel a mass in the area or lymph nodes or underneath your arm that are enlarged. However, that's why mammograms are really important, because they pick things up earlier that we can't even detect. And it really increases people's survival to be able to catch things earlier. So we highly suggest people continue getting their mammograms.
I can mention one more risk factor, and that's nipple discharge, often like a bloody nipple discharge. So if you do find a lump or see any nipple discharge, definitely seek advice of your primary care physician.
Let's talk about early detection. Experts tell patients early detection is really key to diagnosing breast cancer. You mentioned mammograms. What do you recommend that women do in order to stay on top of their breast health?
So I think that there is some data to support self-breast exams, even though we don't necessarily always advocate for that, especially people that have dense breasts or have fibrocystic changes. Those sort of things are not as useful. But yearly mammograms are very useful, especially with people who have high risk factors, as we were just discussing. I know that we have a great group of mammographers that are specially trained in breast health in particular that do our mammograms here.
Yeah, mammograms are really our best defense and our best mechanism for finding breast cancer early when it's most treatable. At a minimum, women age 50 to 74 should get screened at least every other year. And then women with risk factors might consider getting screened a little more often or starting screening earlier.
You've both mentioned dense breasts. I know that some women will get a note on their mammogram results that informs them that they have dense breasts. What is breast density and how does it affect screening results?
Yeah, breast density is something defined on a mammogram. So when you get a mammogram, it's just an x-ray of the breast. And the tissue appears as white on the mammogram, and the cancer appears as white on the mammogram. So when you have a lot of this dense tissue, it's harder to find the cancer because you're looking for something that shows up as white in a bunch of white. So density is just a measure that we take from the mammogram that shows how much that white tissue is on the mammogram. And we have a law in California where if you have dense breast tissue, the mammography facility needs to report it on your letter. So when you get your letter at the top, it says your mammogram is normal. Most women probably throw it away and don't bother reading. But if you keep reading down, you might see a note saying that you have dense breast tissue. And having dense, it's very common. It's not a disease. It doesn't mean anything's wrong. About 50% of women have this. So half women have it, half don't. It just makes the mammogram a little bit more difficult to interpret. So we just want to let women know if you have dense breast tissue, you might want to be extra aware that if you find a symptom to talk to your doctor, even if your mammogram is negative. However, I just want to point out that mammography is still our best tool for finding breast cancer in women with dense breasts. There's a lot of confusion out there where some women think I have dense breasts, so mammography doesn't work for me, so I'm not going to get my mammogram. I'd say it's in fact even more important to get your mammogram when you have dense breasts because density is also a risk factor that increases your risk of cancer compared to women without dense breasts. So I think the message is if you have dense breasts, it's nothing to worry about. It's just that it might increase your risk of cancer a little bit. You might want to get screened every year instead of every other year, but you still need to get your mammogram, and mammography can still find cancer in women with dense breasts, and it's still our best tool for early detection.
The one thing that I would add is density really is the difference between the breast tissue in your breast and the amount of fat in your breast, because that's really what the mammographers look at, is they look at the difference between the two, and that's what helps them determine density and stuff. So it changes throughout your life. So it's not unknown for someone to have really dense breasts when they're, say, 40, but when they're 60, they just have fibroglandular tissue or fibroglandular density or heterogeneous. And so that changes. And it's just a way that we can determine amount of breast tissue versus fat in your breast. And so as Dr. Miglioretti was trying to say is that, or she was saying that it really is just a measure or a documentation of what your mammogram looks like. It's nothing dangerous or scary. It just means that you probably actually should get more mammograms, not less.
It's really useful advice. What advice do you give to women who want to know if there are healthy lifestyle changes that they can make to prevent breast cancer? Maybe they're in a high-risk group and they want to know if there's anything they can do to better their chances. Dr. Sauder, let's begin with you.
So there have been lots of studies that have looked at this over time because breast cancer is so prevalent within society that people want to improve their chances or decrease their chance of getting it. And so people have looked at it, and really the best thing that I can say is living a healthy lifestyle is the best way to prevent breast cancer. So things that we know smoking increases your risk for breast cancer, actually. It does other cancers as well, but it increases your risk of breast cancer, so not smoking. Exercising regularly, really 30 minutes, 5 days a week, whether you lose weight or you don't, actually decreases your risk of breast cancer. And we also know that what your body mass index is, that means sort of your weight for height ratio, that we know having a normal body mass index actually is beneficial and decreases not only your risk of getting a breast cancer, but if you have a breast cancer, having a recurrence is decreased. The other one that people don't talk about as often is alcohol use. We know that alcohol use does increase breast cancer. It's a proportional relationship. So the more that you drink, the more likely you are to get breast cancer. So my advice to my patients after surgery or such is to really limit or minimize those things.
Dr. Miglioretti, would you like to weigh in?
Yeah, I agree. I mean, and all these, the benefits of a healthy lifestyle don't just protect against breast cancer, but against other cancers and cardiovascular disease. So I would definitely echo that. I think one of the most important things is maintaining a normal body weight, exercising, eating healthy, and minimizing alcohol. For women at extremely high risk who have, say, a BRCA1 mutation, there are chemoprevention options. So that would be something to talk to your physician about, whether that would be right for you.
This conversation generally is about women, but can men get breast cancer as well?
Actually, they can. We know that there are usually about 2,500 men throughout the U.S. that get breast cancer a year. It's a very small portion compared to women, but they do have the ability to do that. We know that they have a tendency to be diagnosed later at a sort of more advanced stage because we don't do mammograms in men. And mammograms really, as we said, are what allow women to be diagnosed early before that we can feel it or it's spread hopefully anywhere. And we don't necessarily have that ability in men. In men, it's usually found as a mass, or they feel sort of enlarged lumps under their armpit, which are lymph nodes. And we suggest that they get seen right away for any kind of mass or skin change of their breast. We treat them in some similar ways to women. There are some genetic differences that have been found between men and women. And recently I published on looking at men and surgical options, and they actually have similar surgical options that women do. And so we have the ability to offer them a variety of procedures.
We are with Dr. Candace Sauder and Dr. Diana Miglioretti discussing breast cancer. If you have questions for either of our experts, please post them in the comments and we'll answer your questions toward the end of the discussion. Let's talk about COVID-19. So much of what we talk about these days is within the frame of reference of COVID-19, and a lot of people are staying at home, which means that we're seeing patients delay their routine care, and that includes cancer screenings. What message do you want to give to women who are due or even overdue for a mammogram?
I would strongly recommend that women get their mammograms on time and on schedule. And especially if there's a symptom, do not delay. Talk to your physician and get in to get a mammogram. We are making it extremely safe for women to come in for breast imaging. The breast imaging facility is pre-screening patients for COVID. Everyone's required to wear a mask. They're not changing in the changing rooms. They're going to change in the room with the equipment. They're doing extra sterilization. So there's a lot of procedures in place to make sure it's very safe. Patients get their temperature checked before they come in. So it's more safe than going to the grocery store for sure. So I would not delay, especially if it's been 2 or more years since your mammogram. And again, if you have a breast symptom, talk to your doctor immediately. Do not delay, because that's when it's really important to make sure we get you diagnosed right away in case it is breast cancer. Most lumps turn out to be cysts and nothing to worry about, but we definitely want to get it checked out and diagnose breast cancer as early as possible so that we have the best chance of using less aggressive treatments, which I'm sure Dr. Sauder can talk about, and the best chance for a cure.
I also want to say that sort of as a cancer community, we've looked at breast cancer and especially during sort of the early portion of the pandemic when surgeries were not being done as frequently. And what we found is that less people are being diagnosed with breast cancer because less people are coming in for their mammograms. However, people that are being diagnosed at more advanced stages. And so really delaying that mammogram is very detrimental to people. And so I really strongly echo that coming in for a mammogram is really important for your health. And we've made it as safe as possible. There are tons of precautions that we take with our patients and are able to safely treat people.
I want to take this opportunity to tell our viewers that UC Davis Health is offering free screening mammograms this Saturday, October 31st, for uninsured women aged 40 and over. This is in honor of Breast Cancer Awareness Month. We did it one Saturday earlier this month. And so the second and final Saturday that this offer is happening is this Saturday. And we're going to put a link with instructions on how to make an appointment in the comments section. So if you are an uninsured woman over the age of 40, or rather 40 and over, then please check out the instructions. We're going to put that link in the comments and find out how you can get a free breast cancer screening this Saturday. Both of you, Doctors Sauder and Miglioretti, have recently published research related to breast cancer. Dr. Sauder, let's start with you. Tell us about your article in the journal Cancer Epidemiology, Biomarkers and Prevention.
So this particular article that we published looks at people with secondary breast cancers. We know that women, not only from some of these factors, but that they can have a recurrence after their original breast cancer. They can also get a second breast cancer, a second primary breast cancer, a new one. And we looked at this population and we found it to actually be very different than the normal primary breast cancer population. We looked at it in people that are premenopausal, so under the age of 50, which are sort of our most aggressive group up front for primary cancers. And even within that group, they are more aggressive when they get a second primary. And they are found often because these women are usually very proactive for things like screening at smaller stages before they have lymph node positive disease. But even with those good factors that we usually see for primary breast cancer, they have a tendency to not do as well. And so we're looking at the possibility of needing sort of a different set of recommendations for treatment for them.
Very interesting. Dr. Miglioretti, from your article on risks associated with body mass index or BMI, which you mentioned earlier, breast density by race and ethnicity and menopausal status, what can you share with our viewers about changes in habits and what they need to know related to those factors?
So we've already talked about the role of breast density and BMI in increasing breast cancer risk. So we were interested in seeing if these risk factors were important across all racial and ethnic groups. And what we found is that, yes, they are, that these are both strong risk factors, regardless of your race and ethnicity. And breast density is a more important risk factor for premenopausal women, so women under age 50 or 55, before they've gone through the menopausal transition. And having dense breasts account for up to about a quarter of breast cancers in that population. Whereas being overweight and obese is a very strong and important risk factor for postmenopausal women. Counts for almost a third of breast cancers in Black and African American women, and about 15% in other women. So I think the message is, again, as we've been saying, one of the best ways to prevent breast cancer is to maintain a normal body weight. Have a healthy diet, exercise, and try to either achieve or maintain a normal body weight.
It's good advice for all sorts of reasons to maintain good health. Exactly.
Which is especially challenging during this COVID period when we're stuck at home and with all those snacks. But it's
I know. Lay off the comfort foods. It's good for your health in all kinds of ways. Of course, at UC Davis Comprehensive Cancer Center, we both provide care and conduct research that informs that care. Are there new developments in the treatment of breast cancer that you'd like to tell us about?
So breast cancer is an active area of research, and there are constantly new therapies that come up. The best way I can describe breast cancer is it's really very heterogeneous, but it has one name, but a ton of different diseases sort of underneath that same umbrella. And so here we really personalize breast cancer care to the disease that you have. And so if somebody that you talk to, because everybody knows somebody with breast cancer, and so once you're diagnosed, you go and reach out to all of those people, which is great. Treatments are often very different because everybody's cancer is very different. Sometimes we offer surgery, sometimes we offer chemotherapy, sometimes we do endocrine therapy or radiation, and then we do a variety of mixtures between each of those to personalized care to oneself. We have immune therapies that we use for some of the breast cancer diagnoses, specific ones, and have actually multitude of trials that are open looking at these in other situations.
Dr. Miglioretti, would you like to weigh in on new treatments and therapies and things going on at the Cancer Center?
I think Dr. Sauder covered it. Yeah, I would just say that our treatments have greatly improved over time, and breast cancer survival has greatly increased because of it. So,
and I really strongly suggest people have consultations. I know that there are a lot of people that are nervous because of either people they've known in the past or family members that have had treatments that have been challenging. And all I can say is that our treatments are drastically different than they were even 10 years ago. But from 20, 30 years ago, you wouldn't even recognize the difference between them. And so we really have the ability to do smaller surgeries, less surgery. We more selectively give chemotherapy as well as radiation, and have trials looking at how to do that individually even more with the same outcome, the same survival as what we would have seen with more aggressive care in the past.
I think that just about wraps it up for our questions. And so I'll give each of you a chance to leave us with some parting thoughts and advice for our audience.
sure, I can start. So I know, sometimes there's a lot of confusion out there about when to screen and how often to screen because different societies recommend different things. I'll just stress that the most important thing is to be screened at least every other year, starting at age 50. And then if you're younger, consider your risk factors and also your tolerance for the benefits and harms of mammography. We didn't really get into the harms. The most common, what we call harm, which sounds like a harsh word, but adverse outcome of screening would be a false positive. That means you have a mammogram that's positive and you don't have cancer. I just want to stress that if you're called back from mammography, most women don't have breast cancer. It's really just to get a better look often at something that they see on the exam. So try not to be anxious if you're recalled on a mammogram. If you get regular screened, I guarantee you'll probably be called back at least once in your lifetime, and chances are you don't have cancer. So when thinking about whether you should start screening, you can think about that, your tolerance for the anxiety from that, and talk to your doctor about your risk factors and whether starting screening earlier is right for you. But I do urge at least every other year. That's our most important defense for preventing later stage breast cancer. If you don't have insurance or you're worried about co-pays, reach out to us. We'll help find a way to pay for it. Screening is usually is covered by insurance. It's free. And there's other resources to pay for the screening if you don't have a way to cover it. So don't let cost deter you. We will help you find a way to cover screening and any treatment that you need.
My sort of leaving thought is really about treatment. That treatment has come a long way from where it was before. That there are hundreds of thousands of women that have gone through this and have benefited all the future patients. It's a really scary situation, but just know as physicians, we're here for you, that we want to take care of you, and we want to get you the best possible outcome that we can in a way that meets your needs the best that we can. We have a variety of treatment options, and it really is a patient-physician discussion that comes up with what our long-term plan is for a patient.
Thank you so much, Dr. Sauder and Dr. Miglioretti, for being with us today. We so appreciate your time and all that you do for our patients. Thank you for joining us for this UC Davis Health Facebook Live. If you have more questions, please continue to post them in the comments, and we will forward those questions to our experts so you'll get an answer back in the comments. And we encourage you to share this post if you have family and friends who would enjoy learning from it. For more on the UC Davis Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer. Thank you for joining us.
Thanks, everyone. Stay safe.
Thanks.